This is the Coronavirus Morning Report for Wednesday, May 6th, 2020. I'm Jackson Bird. Where's the beef? Literally, at least in some Wendy's restaurants. A look at that research suggesting there is a mutated strain of the coronavirus that might be more deadly. Pfizer begins human trials of a vaccine, rural infection rates spike, and the citizens of Ireland return a century-old favor. We haven't spoken about this for a while, but prisons continue to be a source of hotspots for the disease. Nearly every single woman in a Louisiana prison dormitory has tested positive for COVID-19. And once again, 2/3 of them show no symptoms. Quoting the Associated Press, "The women of the Elaine Hunt Correctional Center in St. Gabriel are housed in a dormitory for some of the inmates moved out of the Louisiana Correctional Women's Institute after floods in 2016, Department of Corrections spokesman Ken Pastoric said last week. He said 155 women without symptoms were tested after 39 became ill with the disease caused by the novel coronavirus. As of Monday, 192 inmates had tested positive, including 66 who had symptoms, according to the Department of Corrections statistics. The unit has about 195 inmates, though that number fluctuates, Pastoric said Monday, and the chart showed 41 dormitory staffers diagnosed with COVID-19, but did not indicate total staffing. Pastoric said he would check on the total number of staffers and whether all were tested, end quote. One hotspot globally, one country where the charts are only going up, is Brazil. Brazil, worryingly, seems to be on the same trajectory a lot of places were on last month. One indication of that is the fact that the city of São Luís in Brazil has become the first in that country to go into lockdown today. Officials told 1.5 million residents to stay home and tried to seal off travel to and from the city, quoting the Washington Post. As Brazil grapples with the worst coronavirus outbreak in Latin America, the city's court-ordered restrictions go far beyond any measures in the rest of the country, and may influence others to follow suit. Even as the pandemic's daily death toll keeps rising, Brazilian President Jair Bolsonaro has been flippant, if not entirely defiant, in his response. He's insisted that only the elderly and vulnerable should stay home and criticized governors who impose strict measures. But for 10 days, São Luís will turn into a ghost town anyway. Schools, public transit, parks, and most businesses have been shuttered, while most residents are allowed to go outside only to shop at supermarkets or pharmacies, according to the Associated Press, end quote. Residents in China made 115 million trips over the May Day holiday weekend, a promising sign that the gears of recovery are turning over in that country. Students also returned to school this morning for the first time in the city of Wuhan yesterday. While schools had already reopened in other parts of China, this marks the first time thousands of students were back in classrooms in Wuhan. Tyson Foods will reopen the country's largest pork processing plant today after more than 180 coronavirus cases caused the plant to shut down in April. This ties into concerns about the meat supply that have been bubbling under the surface of late. You might have heard this already, but quoting the Washington Post, as of Tuesday, roughly 1 out of every 5 Wendy's restaurants had taken hamburgers off the menu, according to an analysis from the financial firm Stevens Inc., which reviewed menus from each of the chain's 5,500 U.S. locations. The company told CNBC that beef suppliers across North America are currently facing production challenges, and some of our menu items may be temporarily limited at some restaurants. On social media, disappointed diners posted photographs of handmade signs at Wendy's drive-thrus, warning there was no beef on the menu because of a supplier issue. "We have many chicken products available for you to purchase," one Ohio location offered instead. Many of the locations that ran out of burgers this week are located in states like Ohio, Michigan, Tennessee, and New York, where plant closures have disrupted the supply chain, end quote. Vice President Pence said yesterday that the administration's coronavirus task force could be dismantled in the next month because, quote, of the tremendous progress we've made as a country. And the state of Arizona has told scientists to stop work on coronavirus disease modeling, quoting the Washington Post. Scientists who were modeling the spread of the coronavirus in Arizona were told to stop work on Monday, hours after Governor Doug Ducey announced that restaurants and hair salons would be allowed to reopen in a matter of days. An email obtained by the Arizona Republic and ABC 15 shows that the Arizona Department of Health Services abruptly asked a team of roughly 24 experts from Arizona State University and the University of Arizona to pause their work on COVID-19 projections. Those volunteer researchers had been compiling, quote, the most robust public model in Arizona of COVID-19, according to the Republic, and found that cases were likely to dramatically increase unless social distancing requirements remained in place until the end of May. The scientists were also informed that they would be losing access to all the special datasets that they were using. No explanation was given for the abrupt change. End quote. A new study that is yet to be peer-reviewed has suggested that a new strain of coronavirus emerged early on in the outbreak and has become the dominant form of the virus worldwide. One of many mutations of the virus, the specific mutation that caused the study authors concern, named D614G, began spreading in Europe in early February, migrated swiftly to the east coast of the United States, and became the dominant strain globally by mid-March. The study authors flagged a, quote, urgent concern with important implications for SARS-CoV-2 transmission, pathogenesis, and immune interventions, particularly as vaccine development ramps up. The authors wrote, when we embarked on our SARS-CoV-2 analysis pipeline, our motivation was to identify mutations that might be of potential concern in the SARS-CoV-2 spike protein as an early warning system for consideration as vaccine studies progress. We did not anticipate such dramatic results so early in the pandemic. Viruses bearing the mutation spike D614G are replacing the original Wuhan form of the virus rapidly and repeatedly across the globe, end quote. The authors even suggested that the mutation may make people who'd been infected with the original form of the virus susceptible to reinfection with the now dominant mutation. They said, quote, D614G is increasing in frequency at an alarming rate, indicating a fitness advantage relative to the original Wuhan strain that enables more rapid spread, end quote. The findings have profound implications for vaccine development efforts, quoting the LA Times. If the pandemic fails to wane seasonally as the weather warms, the study warns, the virus could undergo further mutations, even as research organizations prepare the first medical treatments and vaccines. Without getting on top of the risk now, the effectiveness of vaccines could be limited. Some of the compounds in development are supposed to latch onto the spike or interrupt its action. If they were designed based on the original version of the spike, they might not be effective against the new coronavirus strain, the study's authors warned. End quote. Not all experts agree with the study's conclusions, however. Bill Hanaj, associate professor at the Harvard T.H. Chan School of Public Health, pointed out on Twitter, link to his thread in the show notes, that it's not clear whether the single amino acid change identified by the study is due to selection as a result of the supposed increased fitness of the mutation strain or mere happenstance. And either way, he argues it likely has no effect on transmissibility or immunity. Drug maker Pfizer has started human trials of multiple coronavirus vaccine candidates here in the U.S. In an unusual move designed to speed up the development process, Pfizer is testing the multiple vaccine versions at the same time in an effort to understand safety, dosage, and efficacy much sooner than would usually be possible. Katherine Jansen, head of vaccine research and development at Pfizer, told The Washington Post, "The pandemic came upon us fast and furious, and we didn't have a lot of time to do years of research. Because of the urgency and the crisis, we said, what can we do to shorten the development time for a vaccine?" End quote. Jansen told the paper that Pfizer hopes to have a vaccine candidate ready for high-risk groups by the fall, which would match the ambitious timeline outlined by a team at the University of Oxford in England, who are also working on a vaccine that has reached the human trial stage. Quoting from the Washington Post about the trial's methodology, the vaccine is being developed with the German company BioNTech, which uses a type of genetic material called RNA to teach a person's immune system to defend against the coronavirus. The trial, initially centered at the University of Maryland School of Medicine and New York University Grossman School of Medicine, administered the first 5 vaccinations to people Monday. 4 out of 5 people in the study will receive experimental vaccinations, and 1 will receive a placebo. The trial will start with healthy young people between the ages of 18 and 55, but as safety is established in that population, it will expand to an older group of study participants, people up to age 85, because of the high risk they face from COVID-19, the disease caused by the coronavirus. Ultimately, researchers will enroll 90 people at each trial site, which will also include the University of Rochester Medical Center and Cincinnati Children's Hospital Medical Center. The data will inform later stage trials designed to test the effectiveness of the vaccine, which Janssen said could start this summer. According to a tracker maintained by the Milken Institute, link in the show notes, there are 123 vaccines in development, of which at least 9 are in the human trial stage. Hong Kong has now dealt with 2 waves of COVID-19 infections, and the techniques it used to tamp down the second wave could provide useful pointers for us here in the US, especially as some states begin the reopening process. Quoting from CNN, Hong Kong had just begun letting its guard down in late February when it was hit by a second wave of the novel coronavirus. After a brief period of low case numbers, new infections spiked dramatically, prompting a series of additional stringent restrictions. That second wave now appears to have largely passed. Hong Kong hasn't had a case of local transmission in more than 2 weeks, and the city is cautiously resuming normal life. End quote. Hong Kong saw its first coronavirus case on January 24th. It closed its borders and began implementing social distancing shortly thereafter, and cases of local transmission swiftly declined. By the start of March, the city had around 150 cases. However, as residents and students were allowed back, they brought the virus with them, to the degree that the case number exploded to more than 700. Clearly, prompt action was needed. CNN explains how the city handled it. Quote, the government took quick, aggressive action to curb the second imported wave. They barred non-residents from entering the city, halted travelers from transiting through the city's airport, and implemented strict quarantine and testing measures on all arrivals to the city, regardless of origin. Those under home quarantine were given electronic bracelets to track their location. The government implemented restrictions like prohibiting alcohol sales in bars and closing all gyms and sports facilities. Many restaurants and cafes closed. Those that stayed open had to cut down seating capacity to increase the distance between customers or put up physical barriers between tables. Though many of these measures were viewed by some as drastic, authorities never ordered an official lockdown or stay-at-home order, relying instead on community efforts and people's compliance to contain the virus. This approach appears to have worked, with new daily cases dropping once again. April 19th was the last recorded local transmission, end quote. With local transmission once again halted, Hong Kong is now moving to slowly reopen its economy. Starting this week, recreational spaces have reopened. By Friday, businesses like bars and fitness centers will be allowed to reopen as long as they keep the number of customers under a cap prescribed by the government. Even schools will restart later this month. The pattern provides an important template for locations in the U.S. seeking to reopen. Ensuring a reduction, if not complete elimination, of local transmission is important to give people the confidence to step outside their homes and resume economic activity. Remember, there was no stay-at-home order to be lifted in Hong Kong. It was about civic responsibility and people's comfort level with going outside. And it's only been since local transmission stopped that people there have been keen in practice to reopen.
Being stuck at home these days, you're probably not thinking too much about internet privacy because you're on your own home network. Fire up incognito mode on your browser and no one can see what you're doing, right? Wrong. Even in incognito mode, your online activity can still be traced. Even if you clear your browsing history, your internet service provider can still see every single website you've ever visited. That's why even when I'm at home, I never go online without using ExpressVPN. ExpressVPN makes sure your internet service provider can't see what sites you visit. Instead, your internet connection is rerouted through ExpressVPN's secure servers. Each ExpressVPN server has an IP address that's shared among thousands of users. That means everything you do is anonymized and can't be traced back to you. ExpressVPN is the fastest and most trusted VPN on the market. It's rated number 1 by CNET, Wired, The Verge, and countless others. So protect your online activity today with the VPN that I trust to secure my privacy. visit my special link at expressvpn.com/report, and you can get an extra 3 months free on a 1-year package. That's expressvpn.com/report. expressvpn.com/report to learn more.
While the rate of infection is starting to slow in urban areas like Detroit, New Orleans, and here in New York City, it's unfortunately rising in rural areas of the country. Urban centers still have more cases and fatalities per capita, but the rate of growth of cases and fatalities is steadily rising in non-metropolitan counties, according to data compiled by the Pfizer Family Foundation. Quoting Talking Points memo, according to the study between April 13th and April 27th, the per capita rate of COVID-19 cases in non-metro counties went from 51 cases per 100,000 people to 115 per 100,000, a 125% increase. The death rate rose commiserately, jumping 169% from 1.6 deaths per 100,000 people to 4.4 per 100,000, end quote. Josh Michaud, Associate Director for Global Health Policy at the Pfizer Family Foundation and a former infectious disease epidemiologist with the Department of Defense, said that this adds up with what we've seen during previous pandemics, saying, quote, "It makes sense that it was urban areas that got hit earlier and hit faster. That's where the disease was first, where the outbreaks were first seeded. And it takes time for that to spread to other geographic regions and because of the less dense geography in rural areas. That partially explains the time delay," end quote. In the leaked government document we mentioned yesterday, the CDC allegedly projects rural areas will be even harder hit than urban ones this summer. Though, take that with a grain of salt, as we still don't know the source of the data and the White House is denying it's been vetted by the task force. Whether the rate of infection is higher than it is or was in some urban centers, rural America is up against some difficult challenges. Quoting again from Talking Points memo, "A decade-long crisis has led to scores of rural hospitals shutting down, with 126 closing since 2010. 47% of rural hospitals in the U.S. were in the red in 2019, according to statistics from the Chartis Center for Rural Health. The nature of the illness as well could wreak havoc on rural communities. America's rural population is, on average, older and has more pre-existing conditions that make COVID-19 more dangerous," end quote. And while people may live farther apart than they do in urban areas, many rural towns are home to large, densely populated workplaces, like prisons, meatpacking plants, and warehouses, where we've already seen some huge outbreaks occur. And some of those states that have been home to outbreaks are also the ones at the forefront of the effort to reopen. Josh Michaud told Talking Points memo, quote, "If we are asleep at the wheel a little bit and we don't recognize that large-scale outbreaks can occur and will occur in rural counties that are especially vulnerable, we could find ourselves very rapidly in a situation where we're looking at severe epidemics. In that case, it would have been premature to relax social distancing and expect that the cases would decline." If the Navajo Nation were classified as a U.S. state, it would have the third highest per capita number of cases of the coronavirus, just after New York and New Jersey. As of Tuesday, there have been over 2,300 cases and more than 70 deaths on the Navajo reservation. The extreme spread can be attributed in part to a high prevalence of conditions like diabetes, a scarcity of running water, and too few hospitals. A fundraiser was organized to help the Navajo and Hopi people, whose reservation is located within the Navajo reservation. As of writing, it's received almost $2 million in donations, and a large chunk of those in recent days came from Irish people repaying a 150-year-old debt. When the Irish faced the Great Famine of the 1840s, it was one of the first humanitarian crises to be shared around the world through the burgeoning global media, according to the New York Times. This led to donations coming in from far-flung locations and communities who felt kinship with the Irish, like former slaves in the Caribbean, prisoners at Sing Sing, and from the Choctaw Nation. Having just been forcibly relocated during the Trail of Tears, the Choctaw people nevertheless rallied together to send $170 to the Irish, the equivalent of $5,000 today. In recent years, the Choctaw and the Irish have struck up a relationship, with the Irish even constructing a monument to the Choctaw in Middleton, Ireland in 2017 called Kindred Spirits. Recalling the Choctaw people's extraordinary generosity in the 1840s, when Irish people last week saw that other tribal nations were struggling against the pandemic, they thought it an appropriate opportunity to return the generations-old favor. Cassandra Begay, communications director for the fundraiser, told the New York Times that in the past 48 hours, more than $500,000 had been donated, and most of that came from Ireland. Gary Batten, chief of the Choctaw Nation of Oklahoma, said in a statement on Tuesday, quote, "We have become kindred spirits with the Irish in the years since the Irish potato famine. We hope the Irish, Navajo, and Hopi peoples develop lasting friendships as we have." That is all for today. As always, this show was produced by Ride Home Media. Talk to you tomorrow. Be well.